It is my honor today to present to all of you some examples of the work that we've done here in Region 7. I am based in Kansas City, and Region 7 for the department consists of the states of Kansas, Missouri, Iowa, and Nebraska, to talk about some examples of some work that we've done in the area of mental health. And I'd first like to bring up a very important example. Right after the devastating tornado hit Joplin, Missouri in May of 2011, it soon became very apparent, both on the television and hearing reports from Joplin, that there would be ongoing behavioral health needs and medical needs for this community. So to facilitate communication between government at several levels, I reached out to our state health officer and some other local organizations that we've been affiliated with, along with myself and Regional Director Judy Baker. We actually traveled to Joplin and participated in a meeting with Governor Jay Nixon to actually identify what medical social needs that were needed within the community. We actually had focus group sessions with the medical physicians whose practices and hospitals were destroyed. We also met with dental providers. But probably the most compelling group that we met with were the behavioral health providers who either their practices or their facilities were destroyed. But they expressed to us the huge need to address the mental health needs in the community were definitely compromised. Not only a lack of facilities, but even before there were a lack of mental health providers to address the needs before the tornado. Afterwards, there was a severe need. Hence, we developed the Joplin Behavioral Task Force. We actually partnered with local groups in Joplin, the Ozark Community Mental Health Center, the local health department, Mercy St. John's Hospital personnel, which that was the hospital that you saw on television that was the regional medical center that was destroyed. We work with the Area Agency on Aging and another hospital, Freeman Health. We work with the state Missouri Division of Health and Social Services, the Missouri Division of Mental Health, and the Missouri Aging Administration. From the HHS response or level group operating divisions we work with SAMHSA, or the Substance Abuse and Mental Health Services Administration, the Administration on Aging, the Office of the Regional Director, and the Regional Health Administrator. We here at HHS, we hosted weekly conference calls to discuss behavioral health needs with numerous stakeholders. And the formation of the task force, as I mentioned, the groups that were involved, developed a plan to using the resources and the federal resources and state resources that were available to develop a plan to create to see how we could best address the mental health needs. SAMHSA was instrumental in helping Joplin develop or identify particular funds. Also, our Assistant Secretary for Preparedness and Response, they were responsible also for providing, very helpful with working with CMS with developing waivers and developing resources for Joplin to actually secure funds to bring mental health providers into the city to assist with some of the needs. We also worked with the state, with Governor Jay Nixon, who was right there at the forefront. And hence, one of the needs, really large significant needs, was to work on the area of developing a center that would address children's mental health issues. And so basically, we then were able, a few months ago, fast forward, to open Will's Place, a children's mental health facility. We were able to bring providers into the area to assist with that, with providing mental health services to the affected children. But that was definitely one of the centers that was greatly needed to provide services and actually bring additional providers in the area. Another very important program that I've been working on is actually working with a coalition, the Military Child Education Coalition. When soldiers have, what we've seen is that when soldiers have returned from their deployments, not only are they dealing with behavioral health issues, but their families have been severely impacted. You're talking soldiers who have been deployed for 2 or 3 times for 10 months to 2 years at one time. And so we started to see rising cases of child abuse, instances of child abuse and spousal abuse, and other behavioral health issues as it relates to the deployment. And so we're working right now with the Military Child Education Coalition. This is a coalition that is focused in on children particularly, but also addressing needs of the soldiers. We also are working with the National Guard members, because when National Guardsmen and reservists are coming back for their deployments, access to mental health or behavioral health services in their communities may not be present. So we are trying to address that particular disparity in working with this particular coalition. And last but not least, this is actually National Prescription Drug Take-Back Day week, where a community basically will identify a day, and a number of our federal agencies, including members in our Office of the Assistant Secretary for Health around the country, are having drug take-back days. And it's a great opportunity for people to basically drop off unwanted prescriptions that they're no longer using into a box. That box, once at the end of the day, that box is taken by the DEA, and those prescriptions, pharmaceuticals that are not being used, will then be destroyed. It's a wonderful opportunity, and we have participated now for the last 3 years in this National Prescription Drug Take-Back Day. So if you are able to identify where a location in your community where that will be taking place, I invite you to participate in that event. I was surprised at the number of unused drugs that we had in our own cabinet. So that is all I have to present today, and I thank you for this opportunity to present this information. And now I'd like to do a segue and introduce our next talk, and just provide you with some talking points on our next presentation. Signs of Suicide, which you will hear about shortly, has been utilized by 24 Garrett Lee Smith grantees since 2005. This is particularly important since evaluation studies have found the program reduces self-reported suicide attempts. Dr. Aseltine, who will be presenting today, conducted the initial SAMHSA-funded evaluation on signs of suicide, and has also done important work on the relationship of alcohol use to suicide in teenagers, and on screening, brief intervention, and referral model to intervene with alcohol abuse for those seen in emergency department. Dr. Aseltine is a professor in the Division of Behavioral Sciences and Community Health at the University of Connecticut Health Center, and the Deputy Director of the Center for Public Health and Health Policy, and Director of the Institute for Public Health Research, both at the University of Connecticut. Dr. Aseltine, we welcome you and look forward to your presentation. Thank you.